Hiya, and welcome to our presentation today, COVID-19 Challenges in Remote Indigenous Communities. My name is Matt Griffiths. I'm the current Victoria Police Sergeant. I was the Community Development Advisor at Warracoona at the time.
I'm Sergeant Kylie Stack, and I'm stationed at the Warracoona MFPA. Warracoona is approximately 8-hour drive from Kalgoorlie, and it is a 5-hour drive from Alice Springs. We're in a designated biozone and it crosses 3 states. We have a school, we have a 24-hour airstrip, we have a store, roadhouse, clinic, pool and church. And Warracoona MFPF is manned by 2 WA police officers as well as a Northern Territory police officer. And we cover 4 communities all up, Docker River, which is in the NT, and Wonanchukla as well as Warracoona. We also have a Department of Child Protection officer there and a functioning court. We're the only WA police station to be managed by 2 Indigenous.
We have about 1,000 camels at any given time.
The health service started in 1979 to what it is now, NG Health, with clinics in most communities across the lands. It's a great relationship, dedicated staff who service a very remote area. We also have access to the Royal Flying Doctors who do after-hour call-outs as well as visits. We also get telechecked and Zoom if we need to speak to a actual hospital in Alice Springs or Kalgoorlie or Perth. We also have nurses stationed there at the clinic, and that is ongoing.
So when did it all begin for us? Easter 2020, neighbouring town, the nurses got a call that one of the elders, Mr. G, was suffering what we believed to be pneumonia. However, when the RFDS doctors consulted, they said you have to treat it as COVID. It was SCOVID, like symptoms of COVID, but we didn't really think it was. However, it was an hour and a half drive. We had to split crews to meet up with the unit. And we brought him and his partner into town, which meant we had to close the clinic and put risk of other patients who were needed or who may need checks or whatever, because that was the end of the clinic for the day because we were treating it as a COVID event. I was asked to find an isolation house at very short notice because we hadn't come across this issue before, whether Mr. G was going to get flown out or stay or where his partner was going to end up. Time was of the essence because it was coming pretty close to night. We had to find a place that was close to the clinic, which again caused other issues. PPE, we had enough to go around. As you can see, I look like a clown in my PPE gear for the airport and driving his partner in and out. However, wearing the mask and wearing all the gear and all the nurses and all the RFDS getting off the plane, we had a reasonable crowd at the airstrip. So this did scare the community that we were actually taking it quite seriously. What issues did we find? Firstly, it was over Easter, so it's always fun to find anybody on during a public holiday. Out in the lands is no different. There was overreactions and there was underreactions. Neither were wrong at the time because COVID was brand new. What do? We didn't know how it was spread, didn't know what we know today. Strangely enough, Mr. G's partner did not want to isolate. She wanted to go home, but we weren't able to get her home because driving at night, unless it's an emergency, is frowned upon by nearly every service, including the police. You don't tend to want to drive on the roads. There are too many animals. It's too dangerous. We couldn't get her back. So we had to find accommodation for her. And once she was in, she had to stay in because she was deemed to be a close contact. A lot of our decisions were made on the fly. We had no great grand plan. It was hard work and something we didn't, I'll get Kylie to explain this next section, something we didn't envisage at the time.
Police had to get involved in regards to the teasing. The family member found that she was suffering from too many people in community teasing her and calling her, making her to feel unsafe. So we had to make sure that the community stayed away from the home. And that was speaking to elders, that was speaking to community members and making sure that they stayed a safe place, a safe distance away from the home, just in case that it was COVID, and to stop teasing, as we say, in making sure that she was feeling safe being isolated from family, because it was a highly stressful situation, not only for her, for the staff, as well as for the community. So our immediate learnings was we are on our own. Warrakoona is so isolated. It's only 90 kilometres from the WA-NT border. We also had to know who was our staff-wise, who was staying and who was going. We also had to know who would pass away, who was our main people in community who was at risk of getting very, very sick from COVID. We liaised directly with NG and WA Police Management, so we always had to make sure they knew what we were doing at a local level in community, and they understood what resources we may have needed at the time. CDA spoke to NG Council in Alice Springs, and they organised an NG COVID manager so that they were getting updates and knew what was happening on the ground level from a distance, and Matt was able to come forward with all the information that we needed to keep the community as a whole safe. So police and CDA, what do we do next? Yeah, it was hard, it was difficult, but we did our jobs.
So some staff left. In fact, we lost staff that very next week at the start of this, and I don't blame them. No decision was right or wrong. We had to work out what was on supply now versus a full COVID outbreak, and how long would it take to get the equipment, which brings us to the belief that everyone believed that the army were going to rappel out of trees and save the day. However, it is a lot of work to get the ADF to come out to anything within an Australian event. They probably would come, but it would take time. So we were on our own for the beginning. NG Management worked out that they would actually fly out and take up roles if staff left or were quarantined during a massive outbreak, and WA Police would supply members from Kalgoorlie in the initial phase. So we knew that we probably had some staff for the beginning of it that wasn't as dramatic as losing all our staff, which was what we thought when we started.
Okay, so with regards to WA Police, we had to step in, so we did an interagency action plan. So we did the LEMAC plan, which is our local emergency management committee. We had regular meetings. We did it with the CDA, NG Health, and the Department of Child Protection. We always made sure we had an inventory on hand of staff, as well as all our PPE gear and where it was located. We also had to make sure we had enough O2 oxygen requirements for the clinics so that we'd never run out, because we knew it affected their breathing. And how do we break down the communities if COVID hits? We basically made it sure that Warrakoona was going to be the hub within our local communities.
And what are we doing it for? We can make all these plans up, but it comes back to the community. We needed the community input. What did the community think and know? Unfortunately, a lot of it was rubbish. It was rumour and poor information from Facebook and YouTube. It was, people saying it was an American disease and it had gone to South America. The biggest example I can find is one of our elder men had homelands in Kintore, so he was driving to Kintore all the time, which actually crosses the state lines 2 or 3 times. And he came back bragging about the fact he'd just come back, and we're saying, you've got to be careful, because if you got arrested in Kintore, you'll end up in Alice Springs for anywhere from 2 to 4 weeks on isolation. And secondly, you might catch COVID. And he turned to us and said, oh no, there's no COVID on my road, it's on your road. So we certainly needed a fair bit of education. We needed the education to come back.
So we immediately outcomes for the community. So from that little COVID scare that we had to do a rundown of a breakdown of events at the CDA office. So we had to make a plan to move the premises between the clinic, the CDA and the CDP offices. So we also made sure we had an instant clinic if the main clinic in Warrakoona was to overrun. We had to make sure there was a whiteboard which would keep a list of staff of local community members who was in, out, unwell, and their locations of where they were. In case of a minor event, what housing was available and where our people would go to isolate, be it staff member or community member. If it was a medium event, clinic and juggling officers. So we always had to make sure we had people on the ground that was working the job. So if someone was isolating, we still had officers there to carry on and doing what needed to be done. In the case of a catastrophic event, the hall, church, and we also had to know where the mortuary locations were in case we had major issues with people passing away.
The whiteboard, was taken from my office in the early days. So we knew where people were in hospital. We knew where they were coming, when we expected them back. Did they have to isolate? Where the funerals were happening, where the equipment was kept, and what housing was available at immediate notice. Signage and how we're going to get better. Energy management put a number of wash stations, which was a big operation across the CDA offices and the stores and or roadhouses across the lands. That was a big effort by them and good work. Social distancing, it was good. I won't say it was great, but it was good. People needed to be reminded to wash their hands and use the sanitizer when they entered the office, but on the whole, never had anybody argue that point. Masks, however, the community believed if they saw masks, something was drastically wrong. So we had a couple of times when staff turned up with masks, the community went into a bit of a tailspin. So it's always, masks are always going to be difficult. We still held regular and ad hoc community meetings as we needed. If the doctor was in town, he would certainly be there each time to give us a bit of street cred, so to speak, and medical support with information. The whiteboard outside had everything from fire, flood, famine to the temperature to the footy scores. That was a new, more communication with the community, the better. And we had an emergency siren at the office. If my car was fleeing town or if the police were fleeing in and the siren was going, people knew something was wrong. We put these signs around the main 4 entry points. This is just before you got into the main hub of Warracoona, one near the airport and one on the Great Central Highway, and there was one out the back as well.
So we also had to make sure we knew who and where people, community members were going, if they were going bush or staying, how we could keep in touch with them and provide assistance if needed. So we also had to do a risk matrix whiteboard. It was an ongoing living document, so it was always changing. We also had to have a list of who was in hospital, who wasn't, what equipment was instantly available for us if we needed. And we also had to do with the church and hall as well as venues for high COVID last resort setup, and heads of department and community meetings with WA Police and the Department of Communities WA for our concerns. So we always made sure that there was that flow of information.
As Kylie said, we had the risk matrix list that was a living document. It kept changing. We had to work out who was the highest at risk, and it was the medical. Unfortunately, most of the medical and elderly was our community leaders and elders. So that was a lot of discussion on how we were going to manage that. The mentally ill, the young and at risk, and especially the fast patients. Where were we going to send them? Did we fly them out? Did they go to Kalgoorlie? Did they go to Alice? Did they go to Perth? Did they? We've got lots of options, or do we move them to the other towns? Warburton had a far larger clinic and can almost be called a country hospital, but it was more a clinic. Lockdowns occurred across most states as this occurred. There was the legal risk to our members. We had to put a lot of effort in. Docker River is literally 1.5 kilometres over the NT border, but between the police and ourselves and health, and over 2 states, 2 big beasts of bureaucracy, trying to get our people over the border just for the funeral. It worked, but gee, it was a lot of work to get them over the border. What would a lawful lockdown like, say, Melbourne or Sydney in Warracoona look like? Wouldn't happen. Very, very difficult. We have travel, we have sorry business, and you've got to think the sorry business can go over 1,000 k's. From Kalgoorlie to Warracoona is a long way. So the 5 kilometre limit would never apply. And the big issue is if somebody in the family unit had any of the above risks and we had to isolate one, it would be 2 issues in one.
So we always had to know and trust our community. Communicate.
Communication with staff is also important. It's two-way. It's vital to making it work.
We also had to make sure we had a central person to coordinate. So police or the CDA. So we'd nominate someone on the dome.
And the truth versus the YouTube Gazette, you know, trust with your community, getting the message out. We're getting there. We've got there. And if you'd like to know anything else about Warracoona, a documentary in late 2019 came out with Kylie's predecessor and Miss Daisy there and Revis in the background. A great documentary on how policing works and the great work that the community did around that. So, palia to everyone and thank you for your time.
Thank you. Bye.